Hello everyone. So I will be discussing with you guys today gestational diabetes. Everyone is familiar with possibly or may have heard of type 1 or type 2 diabetes, but I'll be discussing diabetes in pregnancy. Now what I hope to that everyone gains is information regarding, maybe can share with the family future going forward, but for this specific instance, I'll be discussing the tests needed and steps, and if they do get diagnosed with gestational diabetes, the treatment as well. So starting off with the 50-gram glucose test, this is usually ordered by the provider in the first trimester screening, as well as patients between 24 to 28 weeks. That's usually when their hormones reach the highest of its peak. Now what happens is a patient will come in, they will consume the 50 grams of glucose at the lab, and they get their blood drawn 1 hour after drinking that glucose drink. So what happens at that point is my department, where I work at Kaiser, we're called the Perinatal Service Center, we download the abnormal data. So we only download abnormal data, and what will happen from there is we will give the patient a call to have them come back in to complete a definitive diagnostic test called a 3-hour glucose test possibly. So patients who have a 1 hour abnormal value between 140 to 179 milligrams per deciliter will come back in to complete what's called a routine 3-hour glucose test, which is pretty straightforward. They will get their fasting drawn, then they have 5 minutes to drink 100 grams of glucose drink, which is the same small bottle as a 50 gram, just sweeter, 100 grams this time, and then they get their blood drawn at the first, second, and third hour after the drink. Now, patients with the 1 hour glucose of 180 and above, they are what we call our stat because they are on the higher range. What happens is they will come in and do a stat fasting first, meaning we're looking to get the result within half an hour to an hour. So if their fasting is 94 and below, they will stay there to do the 3-hour glucose test. So it's just like the routine. They give them the glucose drink and then they draw their blood every hour for 3 hours. But if their fasting is 95 and higher, they will stop the test and send you home. So what that means at that point is that there is gestational diabetes, and you'll get another call from us, so normally within 48 to 72 hours, and how to proceed next. Now, as far as once we receive the 3-hour glucose test, that's also downloaded by our department, and we usually only download abnormal data. So what will happen is the 3-hour glucose test, we look for 2 or more elevations. It doesn't matter the sequence. That is used to determine and categorize a patient with gestational diabetes in the pregnancy, or as mentioned before, a really high 1 hour glucose along with the high fasting. Both of those high values automatically as well indicate gestational diabetes. Now what will happen is with the 3-hour glucose test, after it's diagnosed, being that they do have gestational diabetes, we will start treatment. So what that means is my department will be calling and we will be scheduling a meter teach, which is the appointment to teach them how to use a glucometer, as they'll need to monitor at home by finger sticks. So it's a little machine. They monitor 4 times a day until delivery of baby, and they get to log in this lovely blood glucose monitoring book. So this is mailed out normally, typically to all our patients. So after that, they also get an appointment to see a dietitian in going over diet guidelines for them to follow. So if they're for Kaiser Permanente patients, we have a website called kp.org where they can log in and view their account, and that's where they will basically also receive this information that's called diet tips. So, and a Healthy Beginnings newsletter. So normally this is just more information regarding gestational diabetes, and there is a sample menu guide in patient view, which helps the patients a lot as far as what type of foods to eat, because they will be following a diet plan usually of 6 main meals and 3 to 4 snacks in between. Now I hope everyone, with this information, I know a lot of men, this doesn't really apply to me, sorry men, but hopefully, a future spouse or so forth going forward, at least you have gained a little bit of knowledge and information regarding the gestational diabetes, and well, have a good day everyone.